Most people think high blood pressure is a heart problem. They're wrong. The organ taking the most damage, silently, years before any symptoms, is your brain. I've reviewed brain imaging studies on patients in their late 60s and 70s who had no memory complaints, no confusion, no diagnosis. Perfectly fine by their own account. And what I saw on those scans was alarming. Tiny lesions scattered through the white matter, microinfarcts, areas of the brain that had quietly stopped working, not because of a stroke anyone noticed, but because of pressure that was just a little too high, for just a little too long. This is what nobody tells you at your annual checkup. My name is Dr. Elias Thorne. I'm a clinical neurologist based in Chicago. I've spent over 2 decades studying the relationship between cardiovascular health and cognitive decline. In that time, I've worked with more than 4,000 patients over the age of 60 who came to me not because of chest pain or shortness of breath, but because they were forgetting words, losing their train of thought, feeling mentally slower than they used to be. And in a significant portion of those cases, the root cause wasn't Alzheimer's. It wasn't genetic. It was blood pressure that had been mismanaged, or simply ignored, for years. I want you to take what I'm about to say seriously, not because I'm trying to frighten you, but because the window to act is narrower than you think. Here's the mechanism. Your brain contains approximately 400 miles of blood vessels, tiny capillaries, arteries, veins, all under constant pressure. When that pressure is chronically elevated, the walls of those vessels begin to thicken and stiffen. The medical term is arteriolosclerosis. As those walls stiffen, blood flow becomes uneven. Some regions of the brain receive slightly less oxygen than they need. Not enough to cause a dramatic event. Just enough to slowly starve neurons of what they require to function. Over months and years, this creates what neurologists call vascular cognitive impairment. It doesn't look like classic Alzheimer's. It comes in as forgetfulness that seems normal for your age. Slower processing, difficulty concentrating, the inability to hold a complex thought from beginning to end. Most people dismiss it. Most doctors miss it entirely because the patient is functioning, but the damage is accumulating. Here is the statistic that should stop you in your tracks. A landmark study published in The Lancet followed over 10,000 adults aged 40 and older for over 2 decades. What they found was that individuals with untreated hypertension in midlife had a 91% higher risk of developing dementia later in life. Not 20%, not 40%, 91%. That number is not in dispute. It has been replicated across multiple independent cohort studies. And yet, most patients I see over 60 have been told to watch their sodium and come back in 3 months. This is not enough, not even close. Now I want to be specific about what is happening inside your brain right now if you are over 60 and your blood pressure has been running above 130/80. The hippocampus, the region primarily responsible for forming new memories, is particularly sensitive to vascular stress. It has an unusually high metabolic demand. When blood flow is inconsistent, even slightly, hippocampal neurons begin to retract their dendrites. They literally shrink their communication branches. They become less connected to surrounding cells. This is not abstract. This is measurable on MRI. And it begins years before any clinical symptom appears. The prefrontal cortex follows next. That's the region responsible for planning, decision-making, and mental flexibility. When it loses consistent blood supply, you notice it as that mental fog people describe. The feeling of reaching for a word and it just not being there. Or starting a sentence and losing the end of it before you finish. These are not signs of normal aging. I want to be direct about that. They are signs of vascular stress on brain tissue, and the difference between someone who experiences this progression and someone who doesn't, more often than not, comes down to what is happening inside their blood vessels. I've spent the last several years specifically studying what compounds have real, documented evidence for supporting cerebral blood flow, protecting vessel integrity, and reducing the neuroinflammation that hypertension triggers in brain tissue. The research keeps pointing back to the same converging set of targets: nitric oxide production, endothelial flexibility, mitochondrial efficiency inside neurons, and the modulation of a specific inflammatory pathway, the NF-κB pathway, which is chronically activated in brains exposed to vascular stress. Compounds like nattokinase, vinpocetine, and specific forms of magnesium have peer-reviewed data supporting their role in each of those mechanisms. Vinpocetine, in particular, has been shown in clinical research to improve cerebral blood flow velocity, meaning blood moves more efficiently through the small vessels of the brain. That matters enormously when those vessels are already compromised by years of elevated pressure. If you're watching this and you've been told your blood pressure is borderline or a little high, I want you to write down what I just said and bring it to your doctor. Do not wait for a diagnosis to start asking better questions. If you want to look deeper into what I'm recommending today, the link is in the pinned comment below this video. Check it now if you need to. I'll be here when you come back. Now I want to tell you about a few of my patients. Robert is from Texas. He's 69 years old. He came to me after 2 years of what he called senior moments, forgetting names, losing focus midway through conversations. His blood pressure had been running around 138/86 for years. Not high enough to alarm anyone. His primary care physician had noted it, but not treated it aggressively. When I reviewed his MRI, I found early white matter changes consistent with chronic vascular stress. We addressed the vascular component directly and added specific nutritional support targeting cerebral circulation. Within 4 months, Robert told me, and I'm quoting him, "I feel like someone turned the lights back on." His wife noticed it before he did. Bill is 73 from Ohio. He's a retired engineer, detail-oriented, precise, and deeply frustrated by what he described as losing his processing speed. He couldn't follow complex conversations the way he used to. He'd lose the thread of his own thinking. He was convinced it was Alzheimer's. It wasn't. His imaging showed no amyloid burden. What it showed was reduced perfusion in the frontal lobes, a direct result of small vessel disease driven by hypertension that had been undermanaged for over a decade. Bill was skeptical of anything outside a prescription pad, but the research I walked him through was enough to change his mind. He told me 6 months later that his mental clarity had returned to a point where he felt confident again in professional conversations. Frank is 71, from Michigan. His situation was slightly different. He had already been diagnosed with early cognitive impairment and told there was nothing to do but monitor. He came to me for a second opinion. What I found was that his cognitive decline was predominantly vascular in origin, not degenerative. That distinction matters because vascular decline can be slowed and in some cases partially reversed with the right interventions. Frank's family noticed changes within 3 months. He told me recently that he's back to reading a full book a week, something he hadn't been able to do in 2 years. George is 66 from Pennsylvania. He's the youngest of this group and the most important example I can give you, because he came to me before the damage was significant. He had no symptoms. He came because his father had developed dementia at 72, and he wanted to know his risk. His blood pressure was 135/82. I showed him his risk profile. We got ahead of it. George is now 2 years into a proactive vascular brain health protocol. His follow-up imaging shows no progression. He told me recently that this was the most important health decision he ever made, and he made it before he had any reason to worry. That is the point I want to leave you with. The people who protect their brain function best are not the ones who waited for a diagnosis. They are the ones who understood the mechanism early enough to act on it. If you are over 60 and your blood pressure has been anything above optimal, even occasionally, even borderline, Your brain is experiencing some degree of vascular stress right now. Today. And the time to address that is not when your doctor tells you something is wrong. It's now. The research behind everything I explained today converges on one point. I found a formulation that combines exactly these compounds, the ones with real mechanistic evidence for cerebral circulation, endothelial protection, and neuroinflammation control. I'm not here to sell you anything. I'm here to tell you that this formulation exists and that it's what I point my own patients toward. The link is in the pinned comment below. That's the only place I share it. Your brain has been working for 6 decades or more. It deserves the same attention you give your blood pressure numbers, your cholesterol, your heart. The vessels feeding it are under pressure every single day. What you do about that, starting now, will determine what your memory looks like at 75, at 80, at 85. Don't scroll past this. The link is pinned below. Go read what the research actually says.